Downstate Hospital and Medical Center in Brooklyn, New York. We are now going to turn some questions over to Dr. Jason Lazar, Columbia alum from the School of Public Health and the head of non-invasive cardiology at Downstate Medical Center. Hi, Dr. Lazar, how are you?
Hi, Stan. Thanks. Good afternoon. It's good to be here.
Really good to have you. And first of all, how are you doing, and how is everyone at Downstate?
We're doing well. We're resilient. We're doing well. Our most recent surge seems to be on the decline, at least for the time being. So I'm happy to report that.
No, greatly appreciated. And I just know how much Downstate's gone through as an institution. For those of you who are on the Zoom and don't know, Downstate is the COVID center for Brooklyn, New York. It's absolutely been the ground zero for Brooklyn for the pandemic. And along those lines has been really one of the leaders to understand how to approach the pandemic digitally and as a virtual first type of response. We just heard from Daniel Barchi from New York Presbyterian about accelerating the Epic deployment to make sure that they could meet the waves that were coming in across Manhattan and New York Presbyterian Hospital System. And, Jason, from your side, how has COVID over the past year or so now forced different types of entities within Downstate to evolve and adapt digitally?
So, I think the effects of COVID for all institutions has been very profound, and Downstate really was no exception. At the onset of our primary surge, which started for us March 12th, we had to develop a task force. This task force was broken down into various work groups, and we had more than 100 people trying to, faculty, staff, et cetera, from all 5 schools, not just the College of Medicine, trying to keep up with our clinical needs, our clinical call to action, our educational, and also our research mission as well. So it was very complicated. We did rely heavily upon technology, and I think we've had a lot of lessons that have been learned.
I can't imagine. And, one of the things that we saw recently in the Wall Street Journal, it talked about the fact that COVID is here to stay. We saw the report come out from Columbia Medical Center and Dr. Ho yesterday, who, reported on the new variant that Columbia Medical Center found, and about 12% of patients tested over the last few months. That is an unknown variant and seems to be a significant difference in terms of just overall contagiousness and et cetera. What's your perspective on this, and what kind of long-lasting implications do you anticipate the pandemic having on cardiology care?
I think there are several. First of all, I think the long-term cardiovascular consequences of COVID-19 are unfortunately unknown. There was a recent study suggesting that a month later, patients still have evidence of heart damage after their primary infection. And I think those need to be sorted out. I think we've learned to pivot in terms of how we provide care. So the next time around, I think we've learned a number of lessons. Unfortunately, I think some of those lessons are very geo-specific. Go to a rural area, patients are told to stay in their cars until they're called into the office to enhance social distancing and allow for social distancing. Well, that's pretty hard to do in an urban environment where, some people take, accessoride Ubers and even mass transit. I think that there are silver linings of the pandemic as well. People like me try to get patients to reduce their cardiovascular risk factors or control their cardiovascular risk factors in order to prevent cardiovascular outcomes. Well, I think one of the emerging messages here is cardiovascular risk factor modification also reduces morbidity and mortality from infectious disease, such as COVID. Look at the risk factors. What are they? The same ones for cardiovascular disease. Those patients do worse. So this idea of cardiovascular risk factor modification is not just in the cardiovascular realm, but I think is, should be practiced as a global safety measure. And then lastly, I would say, we've made some interesting observations, particularly in pediatric patients. There's been, reports of aneurysm and dilation, enlargement of the vessels that supply the heart, to a condition called Takayasu's or Takayasu's like. And we never really knew the cause of Takayasu's. So obviously these recent observations would suggest that perhaps there may be a viral etiology, as there are for, a lot of non-infectious disease appearing chronic systemic disease states.
That's incredible. We've got time for one more question, and just we're wrapping up at the top of the hour and want to respect everybody's time. Just high level, insight, kind of final comment on how this has affected the downstate community and how you're planning on embarking ahead.
So I think one of the most exciting things really is, and I want to give a shout out to the SUNY Downstate medical students. At the height of the primary surge of the pandemic, some 115 medical students volunteered in 15 different projects. I had the privilege of meeting with the student leadership group. They did everything from secure iPads for patients to speak to their loved ones who are not allowed in the hospital to visit, to attending rounds virtually, almost like a Penny Cruz on Criminal Minds type of situation, where they would round and then call the families and give them updates, food donations, all kinds of things. And when you think about it, it makes incredible sense. The next generation of physicians are energetic. They're more tech savvy than prior generations. And in fact, even after they've helped incorporate telemedicine, they rearranged person-to-person visits and rescheduled them to telemedicine. And now what they're actually doing is impacting our medical school curriculum. They've gone back to the clerkship directors, the heads of, internal medicine and surgery, and have said, look, there are lessons to be learned from our volunteer work in telemedicine. And we think telemedicine needs to be something that is taught at the College of Medicine level for future generations of physicians. So I personally find that very, very exciting.
That's amazing. Absolutely fantastic. And again, thank you. I know how busy you are and really appreciate you sharing some of these insights with not only the audience today who are attending and listening, but also